Hello, my name is Dr. Kadiali Srivatsa, though most people call me Dr. Sri. I need to tell you about something that has haunted me for 35 years. In 1990, I was a young doctor who saw something terrifying. Antibiotics, the miracle drugs that made modern medicine possible, were beginning to fail. And I asked myself a question that would define the next 3.5 decades of my life. What happens when antibiotics stop working? The answer kept me awake at night, because without effective antibiotics, everything we've achieved in medicine over the past century begins to collapse.
Childbirth becomes dangerous again. Routine surgeries turn deadly. Cancer treatment becomes too risky. Organ transplants become impossible. For 35 years, I've been searching for a solution to a crisis that most people didn't even believe was coming. Well, that crisis has arrived, and I have the solution. Let me show you what we're facing. In 2021 alone, 1.14 million people died directly from bacterial infections that antibiotics could no longer treat. Not with resistant infections from them. Antimicrobial resistance was the direct cause of death. By 2050, just 25 years from now, that number will reach 1.91 million deaths per year, a 7.5% increase. The economic cost? $1 trillion in additional healthcare expenses by 2050. And that's just the direct medical costs. But here's what should terrify you most. Since 1990, deaths from antimicrobial resistance among adults over 70 have increased by 80%. 80% are watching older people, our parents, our grandparents, slide back into a pre-antibiotic world. And most people have no idea it's happening. Now let me tell you the part that keeps me up at night, not as a doctor, but as someone who has watched this unfold for 35 years. Right now, somewhere in the world, a pregnant woman is going in for an emergency cesarean section. The surgery goes perfectly. The baby is healthy. But 3 days later, she develops a fever. The infection spreads. The antibiotics don't work. In 2000, this would have been an extremely rare tragedy. Today, it's becoming common. By 2035, if we do nothing, it could become expected. Somewhere else, a 60-year-old man is getting a hip replacement so he can walk without pain again. The surgery is flawless, but the infection that follows can't be treated. He loses the prosthetic. He may lose the leg. He may lose his life. And somewhere else, a cancer patient who survived chemotherapy, who beat the cancer, dies from an infection we can no longer control. These aren't hypothetical scenarios. These are happening today, right now, in hospitals, just like the ones in your community. The procedures that define modern medicine, the ones we've trusted for decades, are slowly failing. And most people don't even know it's happening because we don't measure it. Here's what should make you angry. There is no global system, none, that tracks how antimicrobial resistance is affecting the success rates of essential medical procedures. We know that X% of bacteria in a region are resistant to certain antibiotics. But we don't know what that means for your surgery, your mother's C-section, your father's heart transplant. The data exists. It's sitting in the hospital computers right now. Lab results, surgical outcomes, infection reports, pharmacy records. But nobody is connecting the dots. Hospitals report infections after they happen, but nobody measures which procedures succeed despite rising resistance or fail because of it. We publish annual reports on antimicrobial resistance. But by the time the data is analyzed and published, it's 18 to 24 months old. The resistance patterns have already changed. We're fighting a war against antimicrobial resistance without the most basic intelligence. What is it actually doing to the medical procedures people depend on? It's like fighting a pandemic without knowing who's infected. It's like trying to treat cancer without knowing where the tumor is. We are flying blind, and people are dying because of it. Let me be very specific about what we don't know, but should. 5 categories of medical procedures define modern healthcare. Every single one depends on our ability to prevent and treat infections. Safe childbirth, cesarean sections. We know that surgical site infection rates after C-sections are 5.6% globally, but 11.9% in African regions, and are rising everywhere since COVID-19. But what we don't know is, what's the success rate of C-sections in hospitals where 5% of bacteria are resistant to standard antibiotics versus hospitals where 25% are resistant? Can we predict which mothers face an elevated risk based on local resistance patterns? Should we change the prophylaxis protocol? We don't know because we're not measuring it systematically. Primary surgery, joint replacements, cardiac surgery, abdominal surgery. We know that a 30% reduction in antibiotic prophylaxis efficacy would cause 120,000 additional infections and 6,300 deaths per year in the United States alone. But what we don't know is, has that 30% reduction already happened in some regions? What's the current success rate of hip replacement surgery in areas with high MRSA prevalence? How has cardiac surgery mortality changed as resistance increased? We're performing these surgeries every day without knowing the actual risk. Cancer treatment, chemotherapy. We know that infection is the second leading cause of death in cancer patients. We know that resistance threatens the success of cancer therapy. But what we don't know is, what percentage of chemotherapy courses are interrupted or discontinued because of untreatable infections? How many cancer survivors, people who beat the cancer, are dying from diseases that used to be easily treatable? Organ transplantation. We know that transplant patients face a high risk of infection due to immunosuppression. We know that resistant infections in this population are associated with high mortality. But what we don't know is, what's the actual success rate of transplants in high-resistance settings? Are some transplant programs postponing or canceling procedures because the infection risk is too high? Should they be? ICU survival. We know that ICU patients infected with resistant bacteria have 40% mortality compared to 30% for susceptible infections. But what we don't know is, how much of the mortality gap between wealthy and poor countries is due to antimicrobial resistance? What's the incremental death risk for each 10% increase in local resistance? 5 critical procedures. Hundreds of millions of people depend on them every year. And we don't have the basic data needed to protect them. That is the scandal, and that's what I'm here to fix. So here's what I've built. It's called the Dr. Maya AMR Impact Tracking Framework. And it's the world's first comprehensive, real-time surveillance system, explicitly designed to measure, predict, and prevent the impact of antimicrobial resistance on essential medical procedures. It works in 3 layers. Layer 1, data collection. We tap into existing data streams, hospital electronic records, laboratory systems, and pharmacy dispensing records, and integrate them. No new burden on healthcare workers. No additional paperwork. We measure something I call the Procedure Success Index. Did the procedure achieve its goal without infection? Did the patient go home on schedule? Did they survive 90 days without complications? And we correlate that with local antimicrobial resistance levels. Layer 2, intelligence. We use artificial intelligence, the Dr. Maya AI engine, to process millions of data points and identify patterns that humans cannot see. Which procedures are most affected by resistance? Which hospitals maintain high success rates despite high resistance? And what are they doing differently? What will the resistance landscape look like 6 months from now? And which procedures will be most at risk? Layer 3, action. We don't just watch the crisis unfold. We intervene. Real-time alerts to surgeons. Local resistance to this antibiotic is 25%. Consider an alternative. Automatic notifications to public health authorities. 3 infections with the same resistant organism in 10 days. Possible outbreak. Evidence-based recommendations to policymakers. Here's where resistance is causing the most harm. Here's where to invest resources. This is not a research proposal. This is not a 5-year pilot study. This is a ready-to-deploy system that can be operational in 90 days. Now, you might be thinking, if this is so important, why hasn't it been done already? Good question. The truth is, until recently, it wasn't possible. The computational power needed to process this much data in real time didn't exist at scale. The artificial intelligence required to detect patterns across millions of procedures wasn't mature enough. The hospital data systems weren't digitized or standardized. But now, all of those barriers have fallen. The technology exists. The data infrastructure exists. The AI capabilities exist. What has been missing is someone willing to build it, who has acknowledged the surveillance gaps. National health authorities have called for better data, but nobody has actually built the system. Until now. Dr. Maya isn't waiting for permission. We're not waiting for the next WHO task force or the following research grant. We're building this system now because every month of delay costs thousands of lives. Let me tell you what the world looks like in 2035 if we don't act. Based on current trends, here's what we can expect. A woman going into labor for an emergency C-section faces an 8% chance of severe infection that antibiotics cannot treat. That's comparable to childbirth mortality rates in the 1940s. We will have erased 75 years of progress. An older man needing hip replacement surgery faces a 1 in 7 chance of serious complications. Many surgeons will refuse to perform elective procedures on older patients because the risk is too high. A cancer patient undergoing chemotherapy has a 1 in 5 chance that their treatment will be interrupted or stopped due to an untreatable infection. Someone waiting for a life-saving organ transplant has a nearly 1 in 3 chance of dying from infection rather than organ rejection. Some transplant programs will close entirely because the procedure has become too dangerous. And if you end up in an intensive care unit in many parts of the world, your survival becomes essentially a coin flip. This is not a distant, theoretical future. This is 10 years away. Many of us in this conversation will still be young enough to need these procedures. Our children certainly will. The post-antibiotic era isn't coming. It's here. The only question is whether we measure it, track it, and fight it, or watch it happen. So here's what I'm asking. If you're a health minister, a hospital administrator, or a public health official, partner with us. Implement the Dr. Maya tracking framework in your healthcare system. Start with 5 or 10 hospitals. Give us 90 days. We will show you data you've never had before. We will show you where antimicrobial resistance is causing the most harm. And we will give you the tools to intervene before more people die. If you're with WHO, the United Nations, or another international health organization, integrate with us. We're not competing with existing surveillance systems. We're filling the gaps. The WHO Glass system collects laboratory data. We connect that data to clinical outcomes. Together, we create the comprehensive intelligence infrastructure the world needs. If you're a researcher, data scientist, or technology developer, join us. This is the moonshot of global health surveillance. This is where artificial intelligence can save millions of lives. Please help us build the system that should have existed 20 years ago. And if you're none of those things, if you're just someone who might need surgery someday, who might have a baby, who might face cancer, who wants your parents to get the medical care they need, share this message. Demand that your healthcare system implement comprehensive AMR surveillance. Ask your doctor, what's the infection rate for this procedure in this hospital? What's the local resistance pattern? Make antimicrobial resistance visible. Because what we don't measure, we can't fight. I saw this crisis coming in 1990 when I was a young doctor. People thought I was paranoid. They thought I was exaggerating. They said it wouldn't happen in our lifetimes. Well, it happened. It's happening right now. The nightmare I predicted is unfolding in hospitals around the world. But here's the thing about seeing a crisis 35 years in advance. You have 35 years to prepare. I didn't spend those decades just worrying. I spent them building a solution. Dr. Maya isn't just an app. It's not just a symptom checker. It's a comprehensive ecosystem designed to help humanity navigate the post-antibiotic era. And the AMR Impact Tracking Framework is the intelligence system that makes it all possible. I'm 35 years older now than when I first saw this coming. I don't have another 35 years to wait for someone else to act. The technology is ready. The framework is ready. I am ready. Then the question is, are you? Visit my website, read blogs to learn more. Cool. Share and leave a comment. Let's build the system that saves lives. Thank you.